coming forward, and Dr. Earl Stoddard is here too. As they're coming forward, I did want to recognize and thank Ken Reichert from Senator Cardin's office for being here. Shebra Evans, the president of the Board of Education, is with us. Andy Zuckerman, who's the COO of Montgomery County Public Schools, is here, as are other people from the Board of Education. Casey Caseman, who? Oh, yeah, I have a list here. Casey Caseman from the county exec's office. We also have Ms. Rochelle Rubin from the Assistant Superintendent of Office of Student and Family Support. Mr. Doug Hollis, the Executive Director in the Office of the Chief Operating Officer from Montgomery County Public Schools. Dr. Manifa McKnight, Deputy Superintendent, is here. And I believe someone is here from Senator Van Hollen's staff, and in the back. How are you? Good to see you. And someone from Congressman Raskin's office is here. We have a couple people from Congressman Raskin's office as well. And Dr. Gales, thank you for being, and Dr. Ray McCroll is here from HHS. We have many, many people, and we're pleased everyone is here. I don't know who's going to be leading this off, but Dr. Gales or Dr. Stoddard, it's good to see both of you, and we appreciate this update, and whoever would like to begin, please begin.
I just want to say thank you, Council President Katz and members of the County Council Board of Health for entertaining this briefing today. We're very much interested in having a good conversation and certainly provide information to the public about how we're already responding and sort of how we expect this to play out in the weeks and months to come. I think we can very much say that things are changing. They may change while we're in this briefing, so please do understand we will try and provide the most accurate information up to date that we can, and we'll continue to do so as we move forward. And with that, certainly Dr. Yales.
Well, good afternoon. Thank you, Dr. Stoddard. Good afternoon, Council President Katz, Board of Health, HHS Subcommittee, and everyone in the audience. I hope this excitement continues with all of our public health initiatives that we tackle.
Could I ask you to move your microphone over just the slightest bit? Thank you.
There we go. All right. So in the interest of time, we'll move through our slides. As Dr. Stoddard mentioned, the subject is very dynamic. And in fact, there will be several corrections that I make to the slides that were finalized this morning at 9, and there's new information coming in. So please indulge me with your patience. So just want to give a sense of where we stand. These are the most up-to-date numbers as of this morning, as of 8 o'clock this morning. In terms of cases in the United States, these numbers do not include individuals who were repatriated, in particular those who were quarantined on the Diamond Princess cruise ship. Pending. The number of negative test results so far that have come back have been 5. And this is consistent also with the District of Columbia that has not seen any cases, and the Commonwealth of Virginia, particularly Northern Virginia area. Even though there have been suspicious cases in each of the jurisdictions, all of those cases have up to date as of this morning have come back negative. Next slide. So really want to actually spend a little bit of time making sure that you are the most educated Board of Health in the state of Maryland when it comes to COVID-19, but in particular to the folks at home. If you watch the news over the weekend and lots of the newscasts, we throw around a lot of terms, but there's been very little discussion as to actually what is COVID-19, what are the symptoms, how do you test for it, and where do you go? So I would actually like to spend a little bit of time not indulging too much in the pathophysiology, but I do want to use some science to explain how the disease functions and also give background as to why there's such diversity in terms of how folks have responded. So particularly in the setting recently over the weekend where we started to see domestic cases pop up that are not tied to a significant travel history or exposure to a high risk or medium risk individual. And 2 of those cases unfortunately have passed, and I think actually there's 6 now. So I want to explain the science a little bit to give context as to why there's so much variability in response, and to also hopefully reassure the overwhelming majority of folks here at home and in our community, that we are at low risk for contracting it, and even if one contracts it, they're at low risk for having a severe outcome. Next slide. So this is what coronavirus looks like, or COVID-19. It's important to explain to folks that coronavirus is a generic, oh, it's not a generic term, but it's a specific term that refers to a family of different viruses. The common cold is a coronavirus. SARS, that we saw several years ago, is a coronavirus. COVID-19, which we're talking about today, is a novel strain. And when we say novel strain, what is meant is when we have done the genetic analysis and sequencing of the viral strain, it is something that we've not seen before. And because that makes it a little bit challenging in terms of designing medical interventions and therapeutics, as well as being able to test properly for it, because again, this is something new. But just because it's new does not mean it's not something that we're not entirely familiar with in terms of the family of other viruses within the coronavirus family. Next slide. So this is a picture of your lungs. This is what healthy lungs look like. It's a cartoon. The blow up shows alveoli. So when you breathe in air, it goes through your nose, goes through your trachea, goes down to the bronchi, goes into each lung, and after the bronchi, it goes to the bronchioles, and ultimately lands in the alveoli. Next slide. So the alveoli is where the action happens. The reason why it's important to breathe is you need oxygen. All right? So you need oxygen to breathe. Your body needs oxygen to perform its essential functions. But the other component of breathing is you also need to get rid of carbon dioxide. Carbon dioxide is a major waste product of all of the different